In this video, Dr. Shinault explains what to expect during your first visit. Our unique approach focuses on understanding and tracking your specific goals so that we make sure to meet them as quickly as possible. If you're new to the channel, please subscribe to stay up to date with new content and let us know how we're doing in the comments below. Thanks and enjoy the video.
Dr. Stephen Shinault here, your Ashtabula area chiropractor, and I wanted to reflect and explain one of my blog posts, which is what to expect on your first visit. And I'm going to talk specifically about how it works in my office, but I'll also give some generalizations of what you should be looking for in your own doctors. So for me on the first visit, I like to spend a longer time with my patients. I allow up to an hour for our first visit together. And what we do is we talk through your general health history, your family's health history, any previous surgeries, your allergies, what medications you're on, just so I have a good idea of you. And then what we jump into next is talking in a more focused way about the main reason you came into my clinic. And whether that's headaches, low back pain, you've got a sports injury, we'll sit and we'll talk and we'll try to understand for how long it's been there, why you developed that issue, and if there are any ways that you make it better or worse throughout your day, if you have any medications that have helped, if there's been any exercises you found that help. And what I try to do is I try to put all that information together with you so that we can try to come up with an idea of what exactly your problem is. And while we have that in our heads, this is when we move on to the examination. And during that we do a whole bunch of different movements. We of course check blood pressure, height, weight, all those things that you do at any other doctor's office. But then we do a more focused evaluation as well, right? So if you've got low back pain, we're going to see how you are when you bend. We're going to see if you can pick things up. We're going to see how flexible you are. We're going to see what movements are painful, what movements are relieving. Are there positions that relieve your pain completely? Are there positions that you won't go in because they're too painful? All of those things we find out together, and then using all that information we can choose exactly what we need to do for you so you can get better as quickly as possible. If that means that we need to do some laboratory testing or we need to send you for x-rays or something like that, we do that at that time. Otherwise we usually go straight into the treatment plan. That might include a variety of different things, but I can guarantee you it's always going to include an exercise, because my philosophy and what I like my patients to understand too is that my job first and foremost is to be a helper, to be a coach, to be an educator. And if I can teach you what your problem is and you can understand it and you can repeat it back to me, I know that we're on the same page and I know we're going to have really good results. Because if you understand the issue and you understand what movements you can do to get yourself better, we're going to have a great time together, because you're going to get well fast, I'm going to get to watch you get well fast, it makes me look like a genius and you feel good and you spend less money on care. So if that's the type of thing you're looking for in a doctor, then I'd be happy to work with you. And just know that if you come in, we're going to do some work and we're going to actually learn. We're not going to sit here and make miracles happen. We're going to work together, we're going to work hard, and we're going to get to our goals, and they're going to get to the goals that you want to achieve. Whether that's being able to play with your kids longer, whether it's being able to complete that 5K, 10K, or a marathon, or whether it's just waking up in the morning and having a bit less tingling and numbness in your leg. It all depends on you. So whether you come to see me or whether you go see another doctor, always make sure that your treatment plan is focused on you as the patient. Don't forget that you have a lot of power and you can choose what things you do and don't do. But remember, the most important power you have is to say no to things you don't want to do. If you're looking for some more advice, or you need a referral to another provider, or if you want to come see me, get a hold of me, talk to me in the comments, send me a message on my Facebook. Don't forget to like and subscribe to the video. I'll be happy to work with you or to answer any questions you like, and we'll see you next time.